Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all. We will start immediately our today's video, which is regarding the Roganidan Vikruti Vignyan, Roganidan Vikruti Vignyan syllabus. My dear friends, always remember when you want to study any subject, you must learn by heart. In Marathi, पाठ करून टाका. Syllabus is must. Everybody should know about the syllabus. So, in this video, we are talking about Roganidan Vikruti Vignyan Syllabus, Abhyasakram by CCI. Presented by, of course, myself, Professor Dr. Rajendra Raghuveer Deshpande. I am MD in Ayurvedic Medicine, Kaya Chikitsa, and MD in Kriya Sharir, that is Ayurvedic Physiology. This is my personal website. Yes, www.ayurvedicfriend.com. But that is not much important because everything I am sharing on YouTube channel, on slideshare.com, on the blogs, everywhere you will find Professor Dr. Rajendra Deshpande is sharing knowledge and experience. So you can write me the mail for online consultations, online classes, palmistries. Yes, I do the palmistry. Yes, purpose of this PPT. PPT is based on the new syllabus of CCI, Central Council of Indian Medicine, implemented from 2012. Although it may change in 2021-22, don't worry. Don't worry. Why? Because the essence of the syllabus remains in coming many years. In coming many 50 years, I will say. The content essence will not change. Matter here and there little bit up and down, but original essence contents of the syllabus will never change. And these syllabus points are not useful for only examination. These are helpful for our general medical practice. And that is the Deshpande's motto, to make the confident among the students and teachers and doctors about the medical Ayurvedic practice. Yes, you can do it. This is like the ATP, Advanced Teaching Program, of that particular subject. So we are talking about Ayurvedic pathology today. Ayurvedic pathology. Roga is a disease, and Nidana, here, Roganidana, diagnosis of disease by clinical examination, by laboratory examination. We are studying in this particular subject, Ayurvedic part as well as modern part. Very useful for the teachers, students of the different Ayurvedic colleges all over the India. Students can recite this syllabus, which can boost up their confidence to get success in that particular subject. Teachers and students can download this PPT in their smartphone to keep eye on their subject goal. Because I always feel that syllabus is like a driver of a bus who always know where we have to go, what is our destination, what is our aim, what is our objective. And there is also need in the bus conductor. Ting, ting, ting. Why the conductor? Conductors are like the question banks, past question papers. They tell us during the study of our syllabus where I should stop, the student should stop, the teacher should stop and concentrate more on that particular topic. That can be idea can be sought out from the question bank. So two things are important for the study of any subject. Number one, you must know the syllabus, and number two, you must understand the past question papers. These PDFs are available with me, Professor Deshpande. Here, Sankshipta Roga Vidyan, Vikruti Vidyan, paper 1 and 2, Dr. Anade, Dr. Deshpande, total English language. Here, this is Marathi and English. This book is totally English. Pathology handbook, very, very small, concise. Approximately price of each of these things is rupees 150. So you have to mail me, then I will tell you the exact price. You have to send me by Google Pay, and then I will send you the PDF of this book. Very, very useful. Take it from me. Especially if, have you joined my WhatsApp groups? No, you must join. If you are Marathi speaking or maybe English speaking, I have formed two groups: Marathi speaking students, English speaking students, and doctors as well. So they can register with me by sending me WhatsApp, their personal name, college name, year, and lastly, they must not forget where I should register me, in Marathi group or in English group. Then you can communicate me. You can communicate me by WhatsApp, by messages, by oral audio. Yes, you can contact me. Roganidan syllabus, theory papers 2 marks, 100 each, practical also 100 marks. Paper 1 part A, Dosha, Dushti vignyan. Vignyan is a knowledge. Dosha, Vata, Pitta, Kapha. Which are the Dosha? The body elements which are get afflicted, problematic after the attack of dosha. Dosha are attacking on dhatu and mala. So dhatu and mala are dusha. So how the disease is created? Dosha, dusha, samurchana. Dosha, dusha, samurchana, janito vyadhi. Janito vyadhi. Definition and importance of Roganidan. Ayurveda always say, first you examine the patient, make a differential diagnosis, come to the specific point and then treat it. Rogam adau parikshet. Will you please write down? Yes. Rogam adau parikshet, tato anantaram aushadam. Diagnosis is first and then the treatment. Samanya, Nidana and Samanya Lakshana of Dosha Vriddhi, Dosha Kshaya and Dosha Prakopa. You must know this. Samanya Nidan and Samanya Lakshana, causes and the symptoms. Vata. Vatastu. What is that? Everything. Kafuruddhi Lakshana, Vataruddhi Lakshana, Vatakshaya Lakshana, Lingam Shine Anile, Shabda Sishnuta. They cannot tolerate the sound when the Vata Dhatu Kshayajanya Vata Prabhu. We will learn all these things afterwards. Dosha and Dhatu, Ashraya, Ashrayi Sambandha. Kafu has a good friendship with the Rasadhatu, Mausadhatu, Medadhatu. Vata dosha has a friendship with Astidhatu. Rakta Pitta dosha is a friendship with Raktadhatu. So friendly relation, physiological relation, Ashraya, Ashrayi Sambandha. Dhatus are shelter, media, medium, that is Ashraya. And who is taking? Who is collaborating? Dhatu are Ashrayi. So doshas are making their actions with the help of dhatus, that is physiological relation, Ashraya, Ashrayi Sambandha. Dhatu Kshaya and Dhatu Vriddhi Lakshana. Malakshaya, Malavriddhi Lakshana. If you can remember, if you can try to remember the shlokas of these particular concepts, then it is very easy for you to write down the paper. Elaboration is very easy. But for remembering in a small sentences is very essential. I have already uploaded the important shlokas from first year to last year. From first year to last, important shlokas. Please visit my YouTube channel. How? Give in the search box Rajendra space Deshpande. Only don't write professor. Only this is my YouTube channel name, Rajendra space Deshpande. Then you will get my photo and the toolbar. There you must click playlist. After clicking the playlist, you can search for important shlokas of for all the years by Professor Deshpande. Audio, very interesting. Malakshaya and Vriddhi Lakshana. Hetu, Bheda and Lakshana of Agni Dushti. Jatra Agnimandya. Rogaha Sarve Api Mandegnav. All the diseases from cold to cancer, all the diseases from cold to corona are because of weak digestion, weak metabolism. This is the concept of Roganidan. Definition and Samanya Lakshana of Am. Am is Hindi word is mango. No mango here. Am is like toxin because of the mal what you can say, digestion, faulty metabolism, then toxins are generated. Endogenous causes, exogenous causes, internal causes, external causes. Am, dosha, dushadi vignyan, sama and nirama dosha, and dush lakshana. Whenever anything sama is, then that substance become foul smelling, am, sticky, am, remember. Dosha pak and dhatu pak lakshana. Dosha pak is a curing process. Doshas are curing, but dhatu pak is a more dangerous condition, bad prognosis. Dosha pak, good prognosis. Dhatu pak, bad prognosis. Concept, classification, and diagnosis and general complication of Avarana, covering, obstruction to the different dosha energies. Obstruction, Avarana, obstruction. Dosha Dishadi Vijnan, Dosha Gati, and Roga Marga. Dosha Gati, Urdhva, Adha, and Tiryak. Upward direction, downward direction, transverse direction. And Roga Marga, Koshtashrita Vyadi, in the visceral organs. Shakha in the mouth made dhatu. And Marmashrita, vital organs, brain, heart, kidney. Marmashrita Vyadhi. Roga Marga, where the diseases can be found. Detailed study of Sroto Mool and Sroto Dushti. Srotas concept is very important for physiology, pathology, and medicine in Ayurveda. I will make the separate video for Srotas. Yes, I am going to make it. Then Samanya and Dushti Hetu, Lakshana of all the Srutasas. 13 are important. Actually, there are innumerable Srutas, micro and macro channels. Srutas means channel. Pran, Anna, and Udakavaha Srutas. 7 Srutasas of Dhatus. Rasa, Rakta, Mouse, Made, Asthi, Majja, Shukra. Rasavaha Srutas, Raktavaha Srutas, Mausavaha Srutas, and 3 Malas, Mutravaha, Purishavaha, Svedavaha Srutas. Difference between Sroto Dushti and Kavaigunya. Kavaigunya is anatomical and physiological permanent damage. And Sroto Dushti after Sroto Vaigunya. For example, I have from my birth deviated here septum, DNS, deviated nasal septum, and when I eat the lot of ice cream in the Hemanta and Shishir Rutu, I get the Pratishaya, Srotodushti, Pratishaya, DNS, Kavaigunya. Dr. Deshpande, yes, always in action, packed movement, lot of energetic voice and words. Yes, teachers should have this. Otherwise, I will say difference between Srota Dushti and Kavaigunya. Do you feel happy with that? No, I am sure about it. Vyadhi Vignan. Vignan means science. Knowledge about the disease. Vyadhi. Definition, synonyms and classification of Vyadhi. Vyadhi Ghataka. Like for example, Am is a Vyadhi Ghataka. Dosha, Dushti is a Vyadhi Ghataka. The important elements in the process of disease. Criteria and nomenclature of disease in Ayurveda. Vyadhi Namakarana. How the names are given. For example, Grahani. What is the name? According to organ damage. Udara, according to the organ damage. So there are different systems. Pravahika. How the name has given? According to the condition, pathological condition. Do you understand? Pravaha manasya pravahika. For passing the stool, kunthane in Marathi, straining. That disease is amoebiasis, giardiasis, pravahika. Yes. Bija, Bijabhag, Avayava Dushti, genetic problems in Ayurveda. Ayurveda has explained about genetics science, genetically disorders. Vyadhi Vignyan, basic knowledge of hereditary diseases, congenital diseases, acquired, multifactorial. Agantu, traumatic, and environmental diseases, sunstroke, frostbite because of the ice, Himalaya, Alps, Parvat, mountains. Introduction to ICD classification International Classification of Diseases, big name, of WHO and DSM classification. Samanya and Nanatmaj Vikar, general diseases and specific to that particular dosha. Vataja Vyadhi, Kafaja Vyadhi, Pittaja Vyadhi. Then Nidanarthakar Vyadhi. One disease can be the cause of another disease. Okay? Hetu Sankar, combination of different Hetus. Linga Sankar, Sankar means union. A combination. Then Vyadhi Sankar, one disease is existing and another disease is coming. Diabetes mellitus I have already and I have got the corona infection. So that is Vyadhi Sankar. Diabetes plus corona. Vyadhi Avastha. Niram Avastha, Niram without Am and Sam with Am condition. Vyadhi Vignyan, Dhatu, Padhatu, Mala and Indriya, Pradoshita Vikar. Concept of Asht Mahagad, Ashtau Mahagad. Introduction to Ashtau Nindit, hormonal imbalance, Atikrisha, Atirasva, Atikrisha, Atidirgha, Aloma, Atiloma. This all obesity, low weight, all this contradictory, gigantism, dwarfism, all is explained hormonal imbalances in Ashtau Nindita, 4 pairs of the disease. Vyadhi Vignyan, definition and classification of Vyadhi Kshamatva, immunity in Ayurveda. Very interesting. Vyadhi Kshamatvam nama Vyadhi Balavirodhitvam Vyadhyatpada Pratibandhakatvam iti. Vyadhi Kshamatvam nama, yes, you can write Vyadhi Balavirodhitvam Vyadhyatpada Pratibandhakatvam. One is to control the disease process. Vyadhi Bala. I have to reduce the intensity of the disease. And another is a Vyadhyatpada. Don't want to get corona. Corona control is a different thing. Prevention of corona is a different thing. That is Vyadhi Kshamatva, different types. In the Vyadhi Kshamatva, Oja, Ayurvedic concept of immunity is based on Oja. And what is Oja? Oja is a substance, essence of all the best things from each dhatu. Best rasa, Oj. Best rakta coming to the Oj. Best mansa coming to the Oj. So all the tissues are related with immunity. Because Oj is dependent on all the dhatus, especially which dhatu? Shukra dhatu. That's right. Oj Dushti, Vistrams, Vyapad and Kshaya and its diseases. Basic pathology, modern part. Introduction to pathology and its subdivisions. Introduction to cell injury and cellular adaptations. Definition and brief description of inflammation. Healing and repair. How you can identify inflammation? Rubor, calor, dolor. Rubor means red color. Rubor, R-U-B-O-R, red color. Dolor. What is dolor? Pain. Calor, temperature is high. So you can immediately diagnose the inflammation. Basic pathology, 4th point, definition and brief description of edema and shock, hemorrhage, thrombosis, embolism, ischemia and infarction. Do you know very simple differences? Thrombosis is a stable clot of the blood which is stationary at one place. Thrombosis. Embolism, moving clot of the blood. Moving clot of the blood. Blood clot, but moving. Blood clot, stop. Thrombosis. Okay? Ischemia and infarct. Ischemia, less blood supply. Infarct is stopping of blood supply, infarction. Less blood supply, ischemia. Very simple but very important things Dr. Deshpande is telling during the syllabus. I am going to take details of all these things, okay? Don't worry, be happy. These 3 causes, hemorrhage, thrombosis and embolism, are the 3 important causes of spot diagnosis. Hemiplegia. My half part of the body is paralyzed. Hemiplegia, the 3 important causes: brain hemorrhage, thrombosis and embolism over here. Then ischemia and infarct with relation to the heart. Ischemia is a, yes, angina pectoris. Infarct means heart attack. Myocardial infarction. Yes. Types of immunity, different types of immune responses in the body. Basic knowledge of autoimmune diseases. Acquired immunodeficiency diseases like HIV, hypersensitivity, allergic reaction to your medicines. Remember, what is autoimmune diseases? When if foreign allergic things that I have eat or I have taken, I have smelled, then there may be cold, there may be diarrhea, it's okay. If something foreign body is coming to my body, bacteria, virus, fungi, then my body should fight. But sometimes my body fights with myself, my body cells, like in rheumatoid arthritis, psoriasis, that is called as a autoimmune diseases, problem with the immune system. Okay, hypersensitivity, one of the important thing I have mentioned, injection B1 thiamine, penicillin antibiotic, and interferon or jectofur, iron injections in anemia. These are the examples. If you don't test these injections and give it to the patient may die because anaphylactic reaction. This anaphylactic reactions means hypersensitivity. Yes. Basic pathology. Seventh point, sixth point, nomenclature and classification of tumor. Difference between benign and malignant tumors. Benign is safe, patient can survive. Malignant, cancer is very dangerous. Malignant means cancer. Benign can be painful. Malignant more times is non-painful. That's why it is dangerous, difficult to identify. Then benign is having a little bit fast growth, malignant slow growth. Benign may be a little bit soft, malignant most of the time is a hard nodule, hard tumor. Okay. Introduction to the nutritional disorders, disorders of macro and micronutrients. Macro, deficiency of proteins, kwashiorkor, deficiency of protein and carbohydrate, protein calorie malnutrition, marasmus. Micronutrients, vitamins and minerals. Vitamin A deficiency, night blindness. Vitamin B complex deficiency, stomatitis. Vitamin C deficiency, scurvy. Vitamin D deficiency, osteoporosis, rickets. Yes, you have to study this. Okay. Introduction to infections, bacterial, viral, fungal. Introduction and classification of microorganisms, how the viruses, how the bacteria, how the fungus. Itching is very specific for fungus. Itching, pruritus, is common with the fungal infections, skin infections. Okay. Next, part B, fourth, Nidana Panchaka. You know, Nidana, Purva, Rupa, Upashaya, and Samprapti. These are the 5 elements to understand the disease process. Difference between Roga Pariksha and Rogi Pariksha. These all things are also there in the Kai Chikitsa subject. Remember, importance of Nidana Panchak, Hetu, causes, etiology, definition, synonyms, and classification. Nidana Panchak Vidyan, Purvarupa, definition, prodromal symptoms, warning signals. If the patient has suddenly change in the voice, I am speaking and all of a sudden, since last 3 days, 4 days, 1 month, I am having the different voice. You may suspect after the age of 40, 50 years, if there is no problem like my teaching and all this thing, no cold cough, and still there is a change in voice, it indicates, yes, it indicates laryngeal cancer. Laryngeal cancer, cancer of vocal cords. Don't forget, this is Purva Rupa, warning signals. Rupa, clinical features, 2 types. Rugna Samvedya Lakshana, Vaidya Samvedya Lakshana. Rugna Samvedya means which can be explained, which can be understood by the patient, symptoms. And when doctor examines, he finds something that is signs. So difference is symptoms and signs. Okay. Difference between Vyadhi and Lakshana. Upashaya and Anupashaya, therapeutic test to confirm the diagnosis. Definition, types and importance of diagnosis. Upashaya and Anupashaya. Suppose I have the arthritis. After application of the oil, if I get the increase in the symptoms, that may be Samavayu. Samavayu. But after the application of oil, if I get the relief, that is Niramavayu. Okay. Nidana Panchak Vijnana Samprapti, pathogenesis, definition, symptoms and types of Samprapti Ghataka, Chat Kriyakal, Kshaya, Prakopa, Prasara, Sthana Samshraya, Vyakti and Bheda. That has given Shat Kriyakal, relationship between Nidana Panchak and Shat Kriyakal. Upadrava, complications, and Udaraka, sequelae. Nidana Panchak, Parishta Vignyan, bad prognostic signs. Bad prognostic signs. Definition, types and importance. In the corona, for example, if there is a drop of my oxygen level below 70, below 50, it's a grave sign. Patient can die at any moment. That is Arishta according to Ayurveda. Then Sadhya Sadhyatva, prognosis. Sukha Sadhya, Krikshra Sadhya, Yapya and Anupakramya. My simple rhinitis cold is a Sukha Sadhya. Then I have the hernia that may be difficult to cure because I have to go to the surgeon and take operation of my hernia. That is Krikshra Sadhya, difficult. Yapya, that means still I have the control on my do's and don'ts, that is Yapya. And Anupakramya is little incurable, like for example, third stage of the cancer or HIV. General diagnostic principles of Anukta Vyadhi, which are not directly mentioned in the Samhita Granthas, like Charasushutva, but that is called as the Anukta, which are not explained in the Samhitas. Pariksha Vijnana, importance and knowledge of Aptopadesha and Darshanadhi Trividha Pariksha. Darshana, Sparshana and Prashna. Darshana means inspection, Sparshana means palpation, percussion and auscultation, and Prashna means history taking or interrogation. Chaturvidha Pariksha and Shadvidha Pariksha. Okay, Panchabhautik and Prashna Pariksha. Shabda, Sparsha, Roop, Rasa, Gandha and interrogation. Importance and knowledge of Ashtasthana Pariksha, Ashtavidha Pariksha, Nadi, Mutram, Balam, Jiva, Shabda, Sparsha, Drupakruti. Importance and knowledge of Karanadi, Dashavidha Pariksha Bhav. Examination methods are explained in Ayurveda. Then importance and knowledge of Dashavidha Pariksha, Dusham, Desham, Balam, Kalam, Analam, Prakritim, Vayaha, Sattvam, Satyam, Tatha, Aharam, Avasthashta, Pratakvidaha. Basic knowledge of electrocardiogram, ECG. My dear friends, I have already made a fantastic video how to take the ECG. There are nearly simple 5 minutes clips of 7 clips are there on the YouTube channel. Rajendra Deshpande is my name on the YouTube channel. Then there are 3 important videos. Interpretation of ECG. Please see those videos. Interpretation of ECG. Very important for your practice. Ultrasonography, X-ray, there is radiology, CT scan and MRI. Okay. Paper 2, Part A, systematic study of Nidana Panchak of following diseases, including Upadrava, complication, Arishta, bad prognostic signs, and Sadhya Sadhyatva, that is prognosis. Diseases of Rasavaha Srotas, Jvara, then Jvara Bheda, Am, Pachamana, and Nirama Jvara, then Agantuka Jvara, like infectious diseases, Punaravartaka Jvara, like malaria, Punaravartaka Jvara, Vishama Jvara, malaria, typhoid, Dhatu Gata Jvara, and Charakopta, Sannipatik Jvara, very serious condition of any disease. Sannipatik Jvara, Corona Jvara, Corona fever is Sannipatik Jvara. Although there is a predominance of kapha, but it is sannipathic, three doshaj. General mechanism of fever, introduction to the etiopathogenesis, malaria, typhoid, dengue fever, influenza, and chikungunya. My dear friends, all these videos are available on Professor Deshpande's YouTube channel. Please check those videos and see those videos, make a notes and send feedback to me. Yes, I am very happy. Diseases of Rasavasrotas, all these things will be there in Kaya Chikitsa subject. Don't forget my words. So, physiology, pathology, and medicines are one step ahead. They are always interlinked. Physiology, pathology, and medicine. So, good study of physiology, good study of pathology, and good study of chikitsa. Kriya Sharira, Roganidan, Viruti vignyan, and chikitsa. Pandu, that is anemia, Amavat, rheumatic fever, and early stage of rheumatoid arthritis. Hridroga, IHD, ischemic heart diseases. Shoth, edema. Three important causes: heart, cardiac edema, renal edema, and what is that? Hepatic edema. So, liver, heart, and kidney. Introduction to anemia in its classifications. What is the commonest anemia in India? Yes, iron deficiency anemia. Don't forget my words. Iron deficiency anemia is the commonest anemia in India. There are very few cases or another problems, like for example, sickle cell anemia, thalassemia, that are very rarely that you will get in your practice. Okay, rheumatic fever in the children, post streptococcal infection. First there was a sore throat, and then big joints are affected in rheumatic fever. Big joints like knee joint, shoulder joint, pelvic girdle, okay, and that is a fleeting arthritis. One after another. First, last 2 days he has a knee pain, the child, and then elbow pain, then shoulder pain. So one after another. Rheumatic fever is common in between the age group 5 to 15 years of age. If you don't treat it properly by penicillin, it can have a side effect of mitral valve involvement, that is a complication. Rheumatoid arthritis is very common in the middle age. This is autoimmune disease. There are up and downs, sometimes pain, sometimes no pain. But this rheumatic fever can 100% cured. But rheumatoid arthritis cannot be cured 100% because there is relapse and remission. This is the feature of rheumatoid arthritis. Don't forget it. Hypertension, mild, moderate, and severe hypertension. Hypertension always should be diagnosed on the basis of diastolic blood pressure. 120 by 80. So when it is 90 to 100, mild. 9, sorry, above 80 you can say. Up to the 90, up to the 100 is mild. Then 120 is a 110 and 120 moderate. And above 120 milligram mm of Hg, I'm sorry, mm of Hg, that is severe hypertension. Angina, the Latin word, this is the Latin word. I cry. I cry. Angina. The meaning of angina, heart muscles are crying. Heart muscles are crying. Why? Because they get the less blood supply with the coronary arteries. Then ischemic heart diseases, myocardial infarction, that is heart attack, and CCF, congestive cardiac failure, due to the left ventricular failure or right ventricular failure. Diseases of Rakta Kamala, jaundice, Rakta Pitta, bleeding disorders, Vat, Rakta, gout, and also osteoarthritis, Krishtuka Shirsha, tuberculosis, knee joint infection, Shita Pitta, urticaria, Mahakushta, I'm sorry, Visarpa, erysipelas, Shvitra, white patches on the skin, leukoderma, and introduction to the Kshudrakushti. Next, introduction to the hepatomegaly, liver enlargement, splenomegaly due to the leukemia, blood cancer, leukemia, thalassemia, sickle cell anemia. These patients, they can visit to the nearby Ayurvedic doctors or they can contact Professor Deshpande, because we can support these patients by reducing their frequency of blood transfusion. We can improve little bit platelet count by Ayurvedic medicine in thalassemia and sickle. I am not talking about leukemia. Thalassemia and sickle cell anemia. Introduction to urticaria, allergic reaction, psoriasis, eczema, and pemphigus. Diseases of the mouth of Galganda, and introduction to the thyroid problems, hyperthyroidism and hypothyroidism. Diseases of Medovasrotas, Thaulya, obesity, Karsha, weight loss, and Prameha, including Madhumeha, diabetes mellitus. Introduction to obesity and diabetes mellitus. Diseases of Asthi and Majjavasrotas, Vata Vyadhi, neurological problems, Akshepak, Apatantrak, Ardita. I have already uploaded the video. Bell's palsy, facial palsy, problem with the facial nerve, Pakshaghat. Paksha means extremities, upper and lower extremities, hands and legs. Gridhrasi, sciatica, sciatic nerve inflammation in the leg. What is the test for sciatica? Yes, straight leg rising test. Straight leg rising test. SLR for Gridhrasi or sciatica. Vishwachi, then Avabahuk, then Manyastambha, stiffness in the neck. Katigraha, lower lumbar back pain. Lumbago, Katigraha. Pandutva, like poliomyelitis. Sandhigata osteoarthritis. Asthi Majjagata. Here in Sandhigata and Asthi Majjagata, write down Tikta Kshira Basti. Please. Tikta Kshira Basti. You must try. You learn it. You read the contents and give Tikta Kshira Basti to prevent or to control the relapse. Relapse means excessive trouble, and remission, silent period, relaxing period. Diseases of Asthi and Majjavasrotas, introduction to osteoarthritis, osteoporosis, Tikta Kshira Basti in osteoporosis. Introduction to the Parkinson disease, that is the deficiency of which neurotransmitter? Parkinson, which yes, dopamine. This is the deficiency of dopamine from the basal ganglia, basal cells of the brain. Stroke. What is the another word for stroke? Yes, CVA, cardiovascular accident. I am sorry. Stroke means here brain. Cerebro, not cardio. Cerebrovascular accident. CVA, cerebrovascular accident. CVA, cerebrovascular accident, hemiplegia. Three important causes: hemorrhage, thrombosis, embolism. History of uncontrolled hypertension. Missing the tablets of hypertension, cause of stroke. Pakshaghat, lumbago, sciatica syndrome, Bell's palsy, facial palsy. All the time action. Cervical spondylitis, lumbar spondylitis. Last stage is stiff ankylosing spondylitis. Diseases of Shukravasrotas, male and female reproductive system. Klaibya and Vandhyatva. Vandhyatva, male and female infertility. Klaibya, impotency. ED problem, erectile dysfunction problem. Paper 2 part B. Diseases of Pranavasrotas. My dear friends, on my YouTube channel, the channel name is Rajendra Deshpande. Open it, see on the menu, playlist. In the playlist, please see medicine classes. I have already uploaded digestive problems in GP, respiratory problems in GP, cardiovascular problems in GP, excretory problems in GP. So I have already started to teach you Nidana. Nidana means Hetu and pathogenesis, that I have discussed in those videos. This is your duty to see those videos. Please, my kind request. Gas, cough, Schwas, bronchial asthma, hiccup, hiccup. Then Urakshata, wound in the chest. That is because of tuberculous lesion. Shosh, weight loss. Rajyakshma, tuberculosis. Introduction to the etiopathogenesis of pneumonia, high fever, cough, chest pain, pleural effusion. When the patient, only one side, take a deep breath, ah, doctor, here pain. So when you make an X-ray, costophrenic angle, costophrenic angle is obliterated, is disturbed. That is a specific diagnostic X-ray of pleural effusion. Bronchitis, bronchiectasis. I have already uploaded the videos. Bronchial asthma. Audio is also there. Ayurvedic treatment of bronchial asthma. I have explained it. Please check it. How you can treat the bronchial asthma with Ayurveda. Diseases of unnervous with us. Everything uploaded. Agni-mandya, Ajirna, Agni-mandya, weak digestive. All the same things are explained in Kaya Chikitsa syllabus. Everything is in the Kaya Chikitsa syllabus. But there is more focus on treatment. Here, more focus on causes and pathogenesis. This is the only difference in the subject. Agnimandya, Ajirna, indigestion, Aruchi, no taste, Chardi, vomiting, Amla, Pitta, hyperacidity, Shula, abdominal pain. I have already uploaded. Parinama, Shula, duodenal ulcer, Annadrava Atisar, Gudena, Bahudravasaranam Atisaraha, loose motions. Pravahika, Pravahamanasya Pravahika, Kunthane in Marathi, straining in English during the defecation, amoebiasis and giardiasis. Grahani, Gulm, tumors, Udar, ascites vyadi. Introduction to Anah, Agman, gas in the stomach. Ato, pain in the abdomen. Visuchika, cholera. Alasak and Vilambika. Diseases of Annava and Purishava Sutras. Introduction to peptic ulcer. Irritable bowel syndrome, IBS. Diarrhea, dysentery, constipation, and inflammatory bowel diseases. Introduction to the Udakava Sutras. Next Sutras. Trishna, polydipsia, uncontrolled diabetes mellitus, polydipsia, diagnostic. Three P's are there. Three P, starting with the P word. Polyphagia, polydipsia, and polyuria. Three P to diagnose diabetes mellitus. Excessive thirst, excessive hunger, excessive urination. Dah, burning of eyes, burning of the feet. Introduction to water and electrolyte balance. Huh? I'm sorry. Diseases of Mutra Vasotas, Mutrakrich and Mutraghat. I have already uploaded the videos of excretory system in GP, where you will find which is the playlist. Yes. Medicine classes. You have to click on the medicine classes. Introduction to urinary tract infection, burning micturition, nephropathies, nephrotic syndrome, Svedavasrutas. Introduction to Khalitya, alopecia areata, totalis, alopecia totalis, takkal padna in Marathi, Palitya, premature graying of hair, Upasargaja vyadhi, communicable diseases, corona, COVID-19, communicable disease, Romantika, Masurika, Upadamsh, and Firanga. Contagious diseases from one person to another, communicable. Droplet infection by sexual contact, introduction to measles, viral infection, chickenpox in the children, viral infection, leprosy. There are two types, borderline, tuberculoid, and lepromatous leprosy. Lepromatous leprosy is only contagious. Tuberculosis and AIDS, HIV. Practicals, fundamental principles of laboratory test, introduction to laboratory sterilization, glassware. I have a very interesting book, English language. Please mail me, professordeshpande@gmail.com. You can buy from this book, I don't know, I don't remember, PDF. Then solutions, reagents, safety procedures. Then disposal of biomedical waste. Hematology, HB estimation, Sahali's method. blood cell counting, white blood cells, red blood cell, platelets, hematocrit, packed cell volume, PCV, erythrocyte indices, MCH, MCV, MCHC, mean corpuscular hemoglobin concentration. Fantastic names. Hematology, PBS, staining techniques, Leishman stain, different leukocyte count, peripheral blood film examination in anemia, leukemia, how the PBS is looking. Malaria, filaria, demonstration, ESR, erythrocyte sedimentation test is not diagnostic test, is a prognostic test. Erythrocyte sedimentation rate is not diagnostic. If you want to check whether my treatment is going on well or is not working well, then in tuberculosis, in rheumatoid arthritis, I must ask the patient every after 2 months, please do ESR, erythrocyte sedimentation rate. These tests should be performed on an empty stomach after 14-hour fasting. So if you want to do hemogram, any time of the day is okay. After lunch, after dinner, no problem. But if you write to the patient hemogram plus ESR, please ask the patient go fasting after 14-hour fasting. Water is allowed, but no tea, no breakfast. Okay. Next, screening test for bleeding disorders, BTCT, bleeding time, clotting time. This test should be done even before leech application. Demonstration of prothrombin time, blood group, ABO system and RH system, urine examination, physical examination, 5 tests, color, appearance, albumin, I am sorry, color, then reaction, appearance, specific gravity, this type of physical test. Then albumin, sugar, bile salt, bile pigment, these are the chemical tests and microscopic. Epithelial cells, cast, crystals, etc. Okay. Dipstick, new method of sugar and albumin checking. Stool examination, Sam and Nidana, Pichila, Styanatva will be there, and Jalanimajjana Pariksha. It will dip into the water. Microscopic examination for ova and cyst, amoebiasis and giardiasis, occult blood test. Demonstration of sputum examination, sputum for tuberculosis, physical, chemical and microscopic examination of sputum, sample collection and demonstration for AFB, acid fast bacilli, Mycobacterium tuberculosis, acid fast bacilli. Demonstration of semen examination, very important for infertility, Ayurvedic Anusar Reth Pariksha, semen examination, fructose count, normal count, yes, 120 millions per cubic ml. Biochemical examinations, demonstrations only, because MD you have to perform self, but this is demonstration. Blood glucose level 80 to 110 milligram percent, fasting blood sugar, after blood sugar, after getting the drinking that sugar solution, post prandial or post glucose, it may be 80 to 120 milligram percent. Serum bilirubin, important for jaundice, urea, important for kidney function test, lipid profile in the obese people, heart patients, like triglyceride level, cholesterol level, HDL, good cholesterol, LDL, bad cholesterol, VLDL, very bad cholesterol, creatinine for kidney function, uric acid for arthritic patients to diagnose gout, practical, different staining techniques, RA and Vidal test, laboratory methods, then clinical method, general and systemic examination, instruments used for the clinical examination. So there will be 20 marks long case, 20 marks for short case, demonstration of ECG, USG and radioimaging techniques. And this is the distribution of practical marks. Daily record journals, 10 marks, instruments, 10 marks, laboratory experiments, 20 marks, short case, 10 marks, long case, 20 marks, and Viva was 30 marks. These are the reference book, Madhav Nidan, Nidane Madhava Seshtha. Best book for Nidana subject. Nadi Darshana, Mishra, Nadi Vignyan, Dev Vishishtha. There are a lot of books. R.H. Singh, William Boyds, and Harsh Mohan is the ideal book for pathology. Then there are clinical methods in Ayurveda by Murthy, or Oxford Handbook of Clinical Examination, Chamberlain, Hutchison, all these books are available. Then R.G. Mehta book is there, Practical Pathology, like Uma Chaturvedi. then Medical Laboratory Technology by Sood Harshmohan. All these books are there as a reference books, but Dr. Deshpande's books are also there. Don't forget it. Okay. Robinson's Basic Pathology. Thank you very much. My dear friends, I request all of you to share my videos to your friends. If you are the new viewers, please subscribe my YouTube channel. Also, be a health ambassador and ask your friends to subscribe my YouTube channel to support my genuine hard efforts to share my knowledge and experiences. You can write me your name, college name, year, and if you want to join my groups, WhatsApp groups, Marathi, whether you join or English you want to join. So thank you very much. I wish you all the best. I wish you happy, healthy, and long life. Take care. I am closing my this video and saying you bye bye. Okay, bye bye. Stop the sharing. Okay, bye bye. Bye bye.